My name is Cassidy McGee. I'm a student nurse at Cedar Crest College, and I did my research on the effects of hourly rounding on patient satisfaction. What drew me to researching in this area was I was interested that patient satisfaction is now viewed as a benchmark for high quality care nationally, and insurance companies are even basing reimbursements that are directly linked to patient satisfaction scores. So this means that there's a constant pressure on the healthcare system and healthcare providers to maintain patient satisfaction as an indication of high quality of care. Based off of this, I made my PICO question. In adult medical surgical hospital patients, does hourly rounding compared to only interacting with patients when administering care increase patient satisfaction? I did my literature search using the two databases, PubMed and CINAHL, and I used the search terms patient satisfaction and hourly rounding. From this, I included limiters to only include studies published from 2011 to 2019, as well as only including studies on adult medical surgical units. From these results, I chose 3 studies to undergo critical appraisal, and I chose these because they gave the widest methodology and results, so I felt like it was a very good snapshot, a good overview of the research that is being conducted in this area currently. So the first study is by Blakely et al. In 2011 to determine the impact of intentional, regular, consistent nurse rounding on patient satisfaction. They used a case study method and they implemented the 4P rounding process protocol. They found that this rounding protocol does increase patient satisfaction. And they also noticed that during times of high census, it was a bit difficult to adhere to following this protocol just due to the fact that the nurses were a bit overworked with the amount of patients that they had. So they noted that in future studies, this might also be shown also in clinical settings without studies. The next study is by Mitchell et al. In 2014. It was a synthesis of evidence concerning hourly rounding protocols and their effects on patient satisfaction scores. So this was a systemic review of literature from 16 different studies across a variety of databases, and each of these studies underwent grade analysis, and ultimately the authors concluded that hourly rounding does increase patient satisfaction according to the literature that they reviewed. Unfortunately, they also concluded that there's little consistency in how hourly rounding protocols are collected, and so they are unable to compare the different protocols that are used, and they're also unable to determine which protocols would be better for what unit. So that determination needs to be done on an institutional level. The last study that I looked at was Ulrich et al. In 2012, and they try to determine the effect of hourly rounding not only on patient satisfaction, but also on call-out usage and patient falls. So they did this instead of using the 4P rounding process, they used a 2006 Mead et al. Rounding protocol. And they also looked at occurrence reports, patient satisfaction surveys, and a call-light system retrieval analysis. So the results of this study showed a decrease in patient falls and call-lights, but in the post-survey, such as an HCAP survey, there was no statistical significant difference in patient satisfaction. That being said, in patient interviews recorded on the units, while the patients were still in the hospital, there was reported increase in patient satisfaction. Some limitations noted by the authors for this survey include that it was a small sample size, and so the study was greatly affected by outliers in the data. In addition, there was not continuous support across all 3 shifts for this study, so that might have affected the data as well. Based off of these 3 studies, there are recommendations for practice that each of the studies suggested. So Blakely et al. And Mitchell et al. Suggested the implementation of an hourly rounding protocol that's been studied and concluded effective to increase patient satisfaction that is suited to each institution or unit. Mitchell et al. And Ulrich et al. Recommend that the evaluation of the effectiveness of the hourly rounding system should be written into the protocol from day one, so that the implementation is assessed to see if the protocol fits with the floor and if the nursing staff are actually following the protocol. Lastly, Blakely et al. And Ulrich et al. Also suggest and recommend that staff champions should be designated to foster continued support of the program to ensure that the rounding protocols are being followed. In conclusion, hourly rounding does increase patient satisfaction in adult patients admitted to medical surgical units, and this is shown in both HCAP surveys and interviews from the research. So hospitals should implement a structured hourly rounding protocol to encourage the use of a rounding protocol process. This sets up a strong foundation for the hourly rounding protocol, and this is how hospitals can ensure the greatest chance of success in improving patient satisfaction scores with this intervention. Thank you so much for listening to my research. I look forward to hearing your comments.